Type 1 diabetes. Pathogenesis.
Type 1 diabetes is an autoimmune disease where the body destroys its own beta cells in the pancreas. When you destroy beta cells, it causes the pancreas to become insulin deficient. This makes it difficult for the glucose to move into the body cells, and when glucose can't go into the body cells, it builds up into the blood. This is what causes high blood sugar in type 1 diabetes patients. There is no definitive agent that causes type 1 diabetes, but scientists think that genetics and environmental factors, such as a virus, may trigger the disease. When the disease is being triggered, the process can take many months or even years, and during this time, the individual will be asymptomatic.
Risk factors.
There are many risk factors associated with type 1 diabetes, the first being family history. Anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Since type 1 diabetes is inherited, if a family member has had or has type 1, you are at an increased risk. If both parents have type 1, then the child has a greater risk at developing the disease. Research has been done saying that if the father has type 1, the chance in the child developing is slightly higher. Genetics is the next risk factor. HLA-DQ-A1, DQB1, and HLA-DRB1 genes are all variants of genes that play a critical role in the immune system. These are all part of a family of genes called the human leukocyte antigen, or the HLA complex. The HLA genes have different variations called haplotypes, and people with certain haplotypes, such as the ones I mentioned above, are at a greater risk in having type 1 diabetes. Only about 5% of individuals with gene variants develop type 1 diabetes. HLA variations account for about 40% of genetic risk for this condition. Geography is the next risk factor. It seems that people who live in northern climates are at a higher risk for developing type 1 diabetes. People who live in southern climates, such as South America, are less likely to develop type 1. Researchers have noticed that more cases are diagnosed in the winter in northern countries, and the diagnosis rate goes down in the summer. Age is another risk factor. Although type 1 diabetes can appear at any age, it appears at two noticeable times. The first time occurs in children between 4 and 7 years old, and the second is between ages 10 and 14 years old. It is very unlikely to develop type 1 diabetes at an older age. And the last risk factor is viral infections. Researchers have found that certain viruses may trigger the development of type 1 diabetes by causing the immune system to turn against the body, instead of helping it fight infections and sickness. Viruses that are believed to trigger the type 1 include German measles, Coxsackie, and mumps.
Diagnostics.
Screening for type 1 diabetes is a very new development. It is not available to the public due to the lack of preventative therapy. The scientific tests for screening have only been done with children and have not explored adults yet. The two ways they do this are peripheral blood tests for antibodies and oral glucose challenge. In the oral glucose challenge, a person would drink a sugary substance and 1 hour later have their blood sugar tested to see how they reacted to the sugar. There are many controversial conversations about if the benefits of screening for type 1 diabetes outweigh the drawbacks. The most common benefit to come from screening is the avoidance of diabetic ketoacidosis, which is a life-threatening complication of diabetes where your body cannot produce enough insulin, causing the formation of ketone bodies. Another benefit that comes from screening early is that the beta cells are still functioning, which will cause some insulin to still be produced, allowing the person to not have to receive as much. There are some downsides to screening as well. Because screening for type 1 diabetes is so new, scientists have not really tested the physiological complications that come with telling a person they have a disease with no preventative options. The cost to scan is also a big factor in not allowing it to the public. Diagnosing diabetes is becoming easier as we are learning more. One of the easiest ways to diagnose type 1 diabetes is by taking a random blood glucose test. regardless of when the last meal or snack was. If the blood sugar is greater than 200 milligrams /dl, it suggests diabetes. If the child has fasted overnight and wakes up with a blood sugar over 126, this also suggests diabetes. Another test that uses overall blood sugars is the glycated hemoglobin or A1C test. This test takes the average of the child's blood sugar over the past 2 or 3 months. If the result is a 6.5% or higher, it suggests diabetes. This test should be taken twice for the most accurate results. A final test that can be done is a urine sample test. This tests for ketones in the urine, which suggests not only diabetes, but type 1 over type 2.
Treatments.
The major treatment for type 1 diabetes is just to take insulin. There are 4 types of insulin treatments, though. The first one being short-acting or regular insulin. There's rapid-acting insulin, intermediate-acting insulin, or NPH, or long-acting. You can administer insulin through an injection, but more commonly used nowadays, it is the insulin pump. So this pump is a device that you wear on the outside of your body, and it's programmed so it can hook up to your phone or a device that you carry around with you. There are wired pumps and wireless ones, and most commonly nowadays they are wireless. And this prevents you from sticking injections in your body every day with insulin. Other medications and treatments to treat type 1 diabetes is just to have a healthy diet. You want to make sure you're counting your carbohydrates and your fats and your proteins, and especially while exercising. Along with taking insulin, you want to make sure you're checking your blood sugar level frequently so it doesn't get too high or too low. Something that I found very interesting on a studies website is that there's a new discovery that has been recently found, and it is an artificial pancreas. So the pancreas is the organ that secretes insulin. So when you have type 1 diabetes, your pancreas is the organ that is not working properly. Therefore, the artificial pancreas will mimic the human pancreas by regulating hormones and the glucagon homeostasis.
Clinical manifestations. As we've talked about previously, type 1 diabetes occurs when the pancreas produces little or no insulin at all, leading to high blood sugar. If this goes untreated, it can lead to traumatic symptoms such as kidney damage, nerve damage, blood vessel disease, and more. Type 1 diabetes is different than type 2 because the symptoms can happen suddenly in a matter of a few weeks. These onset symptoms may include increased thirst, frequent urination, bedwetting in children who do not previously wet the bed, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, blurred vision.
Thanks for watching.